Hello and welcome. My name is Marty Hatley. I'm a patient safety advocate and a principal at H2PI, the Healthcare and Patient Partnership Institute. With me today is my co-principal, Armando Nahum. We want to share our thoughts with you today about the importance of finding champions for a Patient and Family Advisory Council on Quality and Safety, or PFACS, PFACQS, and also how to manage the skeptics. Armando, let's start with champions. In an earlier module, we interviewed Sue Collier, an expert, about the importance of finding a champion, someone passionate about the PFACs. She talked specifically about their role in engaging leadership in starting a PFACs, but they're important in other ways too, aren't they?
Oh yes, I can think of two important areas to address here. The first one would be, it's important on the project team, for instance, to, creating a head and heart connection. And I can't begin to tell you how important that is because it really emphasizes how vulnerable we are and it really strengthens empathy. And motivating others on the team, especially when they are a champion because of a personal experience that they are willing to talk about. And the second area, also important, is after the PFAC launches, and like any other resource, a PFAC has to be attended to. Someone who is passionate about growing it and keeping it energized is very, very crucial.
Armando, that's so true. I've got another question. How do we find champions? Where do we look?
Sometimes it's obvious. It's the person who raised the idea of starting a PFAC in the first place, often because of a personal experience they've had, or they may have heard a patient advocate talk about how they lost their loved one to medical harm, and it creates the spark to start a PFAC. But sometimes it's not so obvious. For example, when we started the PFACs, when you and I started PFACs at MedStar Health, we had a champion at the top, at the very top system level. And that was Dr. David Mayer, who was the System Vice President for Quality and Safety. And he set the expectation that every hospital in the system would establish a PFAC. We then had to find champions in each hospital, people who saw it as something more than just a job that they were told to do, more than just a box to check. And certainly there was variation from hospital to hospital. So here are my suggestions if your champions aren't that obvious. Start with the project team leaders. And if the leads aren't your champions, then brainstorm about who in the organizations could be, who has said things or done things that show they are passionate about patient engagement or keeping patients safe. Don't be afraid to ask senior leaders, such as the chief medical officer or the chief nursing officer, or even a respected physician or nurse. And then application and interviews can surface champions too, because staff who apply often do it because of a personal experience or a family experience. And the same thing is true with respect to community members, right? One of the several reasons we highly recommend considering interviewing people for PFAC member slots who have had problems with the hospital is that they are often passionate about helping the hospital learn and improve. I often think of the hospital we visited in Florida a couple of years ago, where the chief nursing officer would recruit community members from their grievance database. But what would you add to that, Marty?
Armando, I agree with all of your suggestions and really don't have much to add to it. It's a good list. As you know, I worry more about the skeptics and getting them on board to support the PFACs. Our colleague Tim McDonald taught us to look for three kinds of people who are often skeptics, and we refer to them as the assassins, the posers, and the saboteurs. So the assassins are easy to spot. They're the people who upfront tell you or show you in their actions that they just are not supportive of the PFACs idea. Often these are people who are concerned about the risk of discussing an organization's dirty laundry with the patient community. What we encourage is to first brief these people so they're not surprised by the PFACs. You don't want them turning on you, later on in the process as you're, almost done. And not only briefing them, but inviting them to be on the project team where hopefully we can bring them along and help them understand the value of what we're trying to do here. The posers are people who say they're supportive but really aren't. So these are the check the box people that you just mentioned. They miss meetings or they multitask during them. They're there because they have to be. And I tend to worry about them only when they are in the PFAC staff positions. If you have a poser, someone who doesn't really have that passion about it, they're not enthusiastic about the PFACs, they don't prepare well. I mean, what we tend to see is meetings getting canceled at the last minute, gets communicated if their head and heart and soul are not into it. Others read that in the PFAC drifts. The saboteurs are those who actively work in some way against the PFAC. So an example would be someone who says they care about the patient and family feedback, but really only want to hear the positive stuff. We don't see them often, which is good, but because they can really stifle growth. But we have to be on the lookout for someone like that who is actively working against you in a way that you don't see as obvious.
Marty, as always, it was a pleasure to work with you today.
Thanks, Armando. I'm glad we took this time to share what we've learned about the importance of champions and watching out for skeptics.